Good morning and welcome back to another edition of This Week in Digital Health. We are joined today by former guest Ed LaHood, as well as Evan from MedReality. Guys, what's going on?
Hey, Mike, it's great to talk to you again.
Likewise.
Good to see you. Good to see you, Mike.
I think it's been probably a year since we talked last time. And
it's been a while, it has.
Yeah.
We were talking about COVID models last time.
That's right. And it's very exciting. So, our core platform is called MedReality, which is what we talked about last time. And MedReality is all about making it easy for clinicians and patients to view medical models in 3D. The idea being when you can view them in 3D, you can really gain a lot of understanding and knowledge, especially, on the patient side, but also on the clinician side for collaboration, for pre-op planning. And we talked last time specifically about something like a COVID lung 3D model that we were releasing into the marketplace. And at the time, it was the first COVID lung model that the public could actually get access to. And it was an incredible kind of educational tool because it allows everyone to see what COVID could do to your lungs. And when you see it in 3D, you can really appreciate that. And it's the kind of thing that, oh my gosh, can even impact your life. When you realize the kind of damage that COVID can do, it may want you to be a little bit more careful or get vaccinated or wear a mask. And this is, circa a year ago when we talked about it, but the idea is still very kind of interesting and even more kind of valuable today in that, 3D models can help educate. And especially on the medical side, and especially for even younger patients. And that's what we're excited to talk to you about today. We have a new product that plugs into our MedReality ecosystem. So the entire MedReality 3D visualization ecosystem allows other products to be plugged in and interface with it. And the product that we're so excited to talk about today is called the MedMirror, which is really incredible. And it is a full-length digital screen that allows patients to stand in front of the screen and actually see inside of their own body. And it's quite miraculous, and it sounds even incredible to hear me say that. But what we've done is create this all new type of device. It's really an entirely new paradigm for devices, along the lines of everyone's familiar with, iPhone and Android and, your PC and your Mac, and even some of the really great newer AR and VR devices like the Oculus Quest and the Microsoft HoloLens. And those are all incredible for experiencing 3D and experiencing, VR or AR. And what we've created, this new MedMirror, is really along the lines kind of a whole next generation of devices like that, where incredibly, a patient can stand in front of this digital mirror. They see a full body perspective of themselves in real time. They can move around. They see themselves in the digital mirror. And then, interestingly, we can overlay 3D anatomies onto their body that are fully body tracked and fully registered with their body, so they can move around, they can turn around, rotate, they can bend their body, and these anatomies are effectively snapped onto their body, and you are effectively seeing inside of your body. And the way we do that is we can actually use patient-specific anatomies from CT scans or MRI scans that are then converted to 3D, and then brought into the MedReality system and then sent over to the MedMirror, where the MedMirror does all of this magic to simultaneously show you yourself in the mirror, track your body, take the 3D geometry, register it to your body, and then overlay it onto your body all in real time and adjust the experience so that as you move around, the 3D geometry, the 3D anatomy stays on your body. So you are effectively looking at your own heart, your own spine, your own bones, your own vascular system, your own musculature. And it's an incredible way for a lot of things, quite honestly. But to start with, when we use the MedMirror for patient-specific anatomies, it's an incredible way to see inside your own body and understand what is going on in your body, whether you're looking at a healthy system or a system that is for some reason diseased or abnormal. So for example, you can look, and see your own skeletal system, your own spine, but for patients that may have thoracic scoliosis, curvature of the spine, when you look at yourself and you see your anatomy, you will see how your spine is curved and exactly how that appears and how it is positioned inside of your body. Or if you have a AAA, an abdominal aortic aneurysm, you can actually see where that aneurysm exactly is in your abdomen as your aorta descends from your heart and feeds the rest of the body. You can see where that aneurysm is on your body. Or if you have a broken bone, or if you have a tumor. And the idea is that when a patient sees this, the level of knowledge and the level of empowerment and the level of understanding, and therefore the types of questions that they can ask, and therefore the approach, the proactive approach that they can take to healing with their doctors and with their families goes to a whole new level. And so what happens as a result of this additional appreciation and understanding is really that the patient can take on a whole new way to proactively address their own health and to proactively heal. And what's also super interesting is that it's all done in a way that is non-threatening, and on the contrary, it's actually interesting and exciting and engaging because the patient's own body is the canvas. And so when this is done in this kind of non-threatening, engaging, exciting way, it also gives them a whole new perspective on what's going on inside of their body, but also from a mental level. It allows them to kind of appreciate everything in a way where they've gained knowledge, but they feel like they've done it in this new, exciting, futuristic way. And once again, gives them a whole new perspective and a whole new attitude to what's going on. And so, and feel free to pop in if you have any questions.
Sure, I have a couple. So if we were looking at this over time, so you will do updates so that we can see progression, correct?
Yes, so a couple of things, and there's a whole, and a bunch more I can tell you about the system here in a second, but that's right. So the idea is that in addition to kind of looking at yourself in this mirror and seeing what's going on inside of your body at this given state, you also have access to all of your potential history, all of the potential, future activity. So definitely you can compare what's going on over time and see progressions. For example, a thoracic scoliosis case in a child where they have curvature of the spine, those cases can be corrected, sometimes by surgery, sometimes by other techniques. And you can see that progression over time and see yourself getting better. And in many cases, we can even show the future. So we can show a current thoracic scoliosis. We know what the effect that the treatment will have. So we can show in advance what's going to happen, how that corrected spine will look, and give that sense of hope to the patient and to the family.
So we can do predictive, right?
Yes. Yeah. In many cases, we can do predictive. Yes. Assuming this treatment, assuming et cetera, this is what we can expect to happen. Right.
And then if I'm on a treatment protocol for cancer, for example, and then I can track and monitor how that protocol is working over 6 months.
There's a lot of interesting angles on that. That's right. So obviously at various stages, we gather additional information, and you can see actually on your body in the mirror how that tumor is shrinking and the progress that's being made. Definitely.
So that should also encourage adherence, right? Because if I'm seeing that it's working, therefore I'm going to continue on the protocol, because it could have potentially side effects which are discouraging. So at least I can see visually that yes, it sucks, but it is getting better.
That's exactly right. That's exactly right. And there's also, interestingly, and we can talk a lot more about this thread, but there's also interestingly ways that even in advance of some type of cancer treatment, like for example, a radiation treatment, you can also see visualizations in the mirror that will help you better understand what this radiation treatment, how it will be working in your body. So for example, if there's some type of seed treatment, there may be worries that, a patient may be worried, oh, I'm going to get radiation all over, but we can show them in the mirror, no, there may be only limited parts of your body that are exposed to radiation. And so they have a better understanding, and a better attitude, and are more comfortable with the procedure and kind of the treatment going forward.
And I'm assuming what we're, looking at is having, more information so that we have an informed patient that can assist in their, the decision-making process, and make some decisions based on what they're actually seeing going on in their body.
That's exactly
right. And everything that we're all about with the MedReality platform is definitely, geared towards empowering the patient, help them make better decisions. I think that's definitely a trend that we're seeing, that people want to take more control of their health options. So, these types of tools, can better educate them. They want to be able to do it, to provide the best care for themselves. They want to be able to explain things to other family members and feel confident. And as Ed even said before, where a lot of the docs that we're talking to who are using some of this technology are saying that they're seeing patients, asking smarter questions and better questions too, because they're better informed through these types of, visual engagements. And I think that's really a big key here is, at the heart of what we're doing, we really feel that people, humans are inherently visual learners, right? And this is a great way to kind of disseminate the information to them.
And are the, the caregivers, are they seeing that by having this tool and having the ability to show patients visually what's going on, are you're seeing patients, be more adherence to programs, or are they, happier in general? Is the patient experience improved because now they have this information and they feel like they're part of the team? How does this work?
Yeah, Mike, and I'll tell you, that's a great question. And that's the, our big focus right now. And it actually transitions into the kind of the second area that I was going to tell you about. So what we're doing now is starting on a variety of kind of clinical studies, with actual patients, with doctors around the world, with various types of procedures, with various types of health conditions, and introducing this into the medical environment and getting all of that quantitative and qualitative feedback. And one of the other really interesting kind of aspects of the MedMirror, in addition to utilizing patient-specific anatomies, which is incredible and miraculous, another way that the MedMirror can be used is to utilize generic anatomies, to teach folks, to teach potential patients, to teach kids of all ages, to teach adults of all ages about your body and to how to proactively, encourage good, healthy habits. So for example, we can use a general heart and a general skeletal structure and, general liver to show you, don't drink too much and how it would affect your liver. General lungs, don't smoke too much, how it would affect your lungs. And also show animations, how your circulatory system works, how your digestive system works, how a virus spreads in your body, what happens when you take this medication. So the idea, when we kind of, look at the second aspect, first, patient-specific anatomies, second, general anatomies, the idea of using general anatomies really in any type of context, whether it's hospital lobbies or waiting rooms or pediatric wards or innovation laboratories or simulation labs, any of these areas where there may be people or patients who are in a medical environment and realize that delivering this kind of information in this kind of new, exciting, interactive way, just using general anatomies and showing you what your heart, where your heart is in your body and about your heart, where your aorta is, where your spine is, where your lungs are, what they do, how they work, how to protect them. That can also be incredibly valuable for kind of the entire future, healthcare understanding, attitude, approach to staying safe, approach to staying healthy. And so this use now of general anatomies is picking up a ton of steam for using, the MedMirror as a general education tool, but in this whole new way, in this using the same level of engagement and excitement and experiential contact where your body is the canvas, but delivering the message to people in healthy environments where they're not so worried about themselves and a specific condition. Now they're engaged and learning about their bodies in a whole new way that allows them to proactively kind of take care of themselves and understand more than they ever did before.
So, when we typically look at digital health products, we look at what I'm going to call the 4 Ps, right? And we've addressed 2 of the Ps. We've addressed the patient, we've addressed the provider. What's the payer's perspective on this? Why is this, why is this something that the payers would encourage?
Well, and so there is, and here again, and the whole, there's a excellent, many excellent discussions to have kind of on this front. And let me even kind of tell you about the third aspect of it, then we'll come back to the payers, because all of it kind of works, I think, in a wonderful kind of cohesive way. So there's a third aspect to this, which is beyond the direct education about your body or about anatomy or about physiology or about specific conditions. There is this third aspect of uplifting the patient's spirit, and especially in the context of children's hospitals and pediatric wards. And one of the things that we realized is that, my gosh, if we have this wonderful mirror device available in general hospital environments and children's hospitals and pediatric wards, in addition to teaching them about education and anatomy and all of that, which is fantastic in a very direct way, there's also ways to uplift the spirits and to really delight. And we can do that on the MedMirror by using characters. And the idea is, and we can show you some videos and send you some videos, but the idea is, within this mirror, it is really a new type of platform where we can deliver any kind of content to the user and make it interactive and make it, use their body as both the canvas and the controller in an incredible way. So in addition to showing you, your spine on your body, I could also turn you into your favorite superhero or your favorite Disney princess or your favorite, Pixar character, and allow you to stand in front of the mirror and move around. And now, you've become Iron Man, or you've become Buzz Lightyear, or you've become Cinderella, and you can control them and move around. And
you got some licensing issues, but I get the concept.
Well, no, and everybody in the world out there understands that, including Disney. A lot of licensing issues, but there's also, I say that as kind of, the vision, but there's also general characters. You can become a teddy bear, you can become a giraffe, you can become Santa Claus, right? Too easy. And the whole idea is that all of these bring a smile to the kids and change their life in that minute and in that day. And beyond that, beyond just you becoming Santa Claus, we can show you in the mirror next to Santa Claus. So we show you, we show Santa next to you, we show a teddy bear next to you, we show Buzz Lightyear next to you, and you're moving around and dancing with your favorite superhero or your favorite character in the world. And, your parents are shooting video of it, you're shooting video of it, you're interacting, and, young girl dancing next to Cinderella is a dream, right? And we're creating something that for kids in a children's hospital where they're there for a short-term stay, a first stay, a long-term stay, they're scared, they're in a new place, they're probably, they're sick. This, for a few seconds or a few minutes or a few hours, absolutely can uplift their spirits and absolutely can give them a whole new perspective and delight them. And even we can create interactive experiences where, those characters encourage the kids, coach the kids, create ways for, even further interaction where, the kids are given an entirely renewed spirit. And so all of this kind of comes into play as the MedMirror platform, is fully realized. It's a way to educate, it's a way to kind of provide hope, and it's also a way to uplift the spirit and do it in a whole new kind of magical way.
But let's look at this from a business perspective.
Yes.
Is that something like, to turn me into my favorite Disney princess, which I very much appreciate, but is that something that, who's going to pay for that?
Yeah, and so here's and this is a great discussion, and I'll tell you, and I'll just as a little bit of background, we just, we were at the RSNA show, at the big RSNA, which is the big radiology show, back in December. We actually introduced the MedMirror and showed it publicly at the RSNA 3D SIG, which is the special interest group 3D of RSNA, and this was just back in April of this year. Then we showed it at the Rapid show, which is the big additive manufacturing show in Detroit in May. And at all of those shows, and this is just taking a high level and then drilling down, there is a lot of ongoing, discussion, momentum, understanding in the medical community of anytime you're talking about anything, and I'm going to talk about 3D for a second, just because that's the derivation of where we came from, and then I'm going to go to the MedMirror and our product specifically. But anytime you're talking about right now, today, at this point in time, anytime you're talking about any type of 3D visualization within a medical context, the question and the issue always comes up to, okay, who's paying for this? Who's going to pay for this? Is the patient going to pay for it? Is the hospital? Is the insurance company? And what are the workflows? And how does that even going to work? And one of the very interesting things is that there is a ton of discussion and momentum and working groups around all of that right now, because there are many hospitals around the world who are jumping into 3D visualization in general in various forms, whether it's 3D printing of cases that they've been doing for many years, whether it's using AR and VR to digitally represent 3D and share it with patients or clinicians, or pre-op planning, or even using it during surgery. And all of that discussion revolves around these main things: who's going to pay for it, what codes can we develop that standardize these areas of care, and then how can those codes be billable, and all these different types of codes can exist, and there's phases of codes as they become available, and so that is all kind of the backdrop. Who will pay for this, and also in that context, what are the various ways to establish or justify value for this technology? Meaning, if printing something in 3D or visualizing something in 3D helps the patient on the wellness front, it helps them understand, helps them ask better questions, helps them get better sooner. How do you quantify that? If it brings in new patients because you can market the fact that you have this technology, can you quantify that? If it prevents patient outflow, can you quantify that? If it reduces the time in surgery because pre-op was so valuable, you cut the surgical time by 3 hours, can you quantify that? So all of these types of value propositions factor into any type of 3D purchase decision right now, meaning everyone who's doing any kind of 3D in the medical universe is looking at all of these things to help them understand, okay, even when they buy a 3D printer, or they purchase a MedReality license, or they purchase a MedMirror, they need to justify that cost within their own hospital system environment. And so it becomes a question of, not so much who is going to pay for it, but it is that, but it's also how is that cost justified within the medical universe? And is it a cost that can be, passed through to the patient? Is it a cost that insurance companies will pay for? Is it a cost that we can justify because, it helped us market people and get one more surgery this year, and that pays for everything? Did it reduce outflow and help us keep 5 more patients, and that paid for everything? Did it reduce the number of times the patient had to come back, and that paid for everything? So all of these things are, quite honestly, part of many of the studies that we're involved with, and analysis, and being quantitatively understood and qualitatively understood. So at the end of the day, right now, today, when we sell something to a hospital, whether it's a MedReality license or a mirror, right now the hospital is paying us for it. But in that universe and in that context, the hospital, and this is what's going on everywhere, the hospital is also paying for it, but with the understanding that they will be recovering that cost, somehow, some way that makes sense for their business and their bottom line.
Yeah, we're going to look at it from a value-based care perspective. Either we're going to improve the outcomes create greater efficiencies within the organization or reduce the overall costs.
Right.
And, if you can do one or more of those, then they're traditionally willing to pay for it.
That's right. That's right. And those right now, those analyses are being done on a per hospital system or a per hospital or a per department basis. But that's exactly right. I mean, those three main kind of metrics, those three main contexts are how they view everything. And right now, and as we said, we're still developing a lot of that quantitative data, but a lot of the kind of, initial sense and understanding is that these types of things are a very good investment because of either the money saved or the money recouped, or the loss prevented or the efficiency gained, or in some cases even additional revenue brought in. And so there is a broader and growing understanding that it does make good business sense to invest in this technology.
And are you having discussions with pharma?
So interestingly, we some of our biggest early customers were big pharma customers with the MedMirror. We actually have been developing the MedMirror for many years, and two of our big early customers for the MedMirror were with pharma companies who were using the MedMirror to illustrate how their potential drugs helped your body or interacted with your body. And these were done in some cases where before the drugs were even approved, and they were looking for ways to educate without saying the name of the drug or directly promoting it. And they could use the MedMirror to illustrate the effect that the drug would have, for patient education, for physician education. So I mean, there is, read my mind. Yes, there is a lot of application for this across the board beyond just hospitals. Yes, pharma is also a big, area for this.
And so, let's round out with the last component, which is the payers. Do the payers see, like you said, do they see the value of the potential to, change the care outcomes, create cost efficiencies? Is this something that they've, embraced yet, or they're still taking a wait and see?
No, I think, and interestingly, this is an area where, of course we're out there, we're showing our technology, we're evangelists, we're educating everyone, but we aren't the only ones that are educating everyone. There's an entire industry of visualization and 3D, big players who are in this industry. My gosh, everyone from Microsoft and GE Healthcare who are in one way or another, pushing the medical industry to understand and embrace, and the payers specifically, to realize the value proposition for all of the many benefits of using this technology, as we've been talking about. And wonderfully, and everyone we're talk to, we're able to ride on a lot of that industry knowledge and industry education and industry momentum that has been happening and is still happening today. And I think, as we've mentioned, I mean, there is a lot of excitement and a lot of enthusiasm, and even on the payer side, a lot of realization that, oh my gosh, technologies like this, and the MedMirror specifically, can dramatically impact many of the areas that we've talked about. Patient outcomes, reduced time in the OR, reduced out-migration, increased, marketing to increase patient load. I mean, all of those things, and improved efficiency, increased revenue, decreased cost. It checks all the boxes. And so yes, and a lot of it still needs to be quantified. A lot of it still needs to kind of be, formally approved and codes established, although there are many codes in the works now at various stages of the process. So it's all happening. It's all happening, but there is a strong understanding and sense now, even from the payer side, that yes, I mean, there's a lot of value add with this technology, and all of that is kind of, happening quickly, but still in process. But we're confident, and that it's all going to move in the very positive direction for everyone, for us, for patients, etc.
So I'm going to ask you sort of a big general healthcare question, and we've seen the technologies that have emerged, particularly around digitalization. And most of our big healthcare systems are somewhat antiquated and aren't up to speed. Is that being polite? So, while they're expressing interest, are they ready to, execute this? Where are they in actually bringing this into the system?
And it's a great question, Mike. And I'll tell you, and that was quite honestly, what you just said is also kind of how we used to think. Also, we used to really perceive, and this is before we were really as immersed in the healthcare industry as we are now. We also used to perceive kind of the medical industry, the healthcare industry, as being, set in their ways and potentially slow moving and hard to kind of shift to new advancements for all the reasons you expect. I mean, of course, things have to be tried and true, and physicians and surgeons and administrators are really set in their ways. And we thought, my gosh, the medical industry would be the last one to embrace this new technology, right? And one of the things that we've seen that's really surprised us is that in many cases, when you talk about hospital systems, big hospital systems and hospital environments, of course, because they have to be careful, they have to be set in their ways. They can't be just grabbing and applying every new technology that becomes available willy-nilly, of course, and everybody understands that. But one of the things that we found, and this is, I think, what's true and what helps in the industry, is that there are many hospitals out there and many hospital systems who want to use the latest advancements and want to use the latest advancements for a lot of reasons, because it can help their bottom line. So there's business decisions, because it can help patients, because it can improve efficiencies, all the things we've talked about. And what we found is that in many of these hospitals and hospital systems, there typically is, a group of physicians or a group of radiologists or a group of surgeons or a group of administrators who really become advocates for this technology. And they're the ones, they're kind of like the evangelists that are living inside this specific hospital or this specific hospital system. And that's kind of what it takes. These evangelists who, beyond all of their daily work of being a surgeon or helping patients, have now also embraced this technology because they believe in it and they know it can help. And we see this over and over and over and over again. They're the ones, it's kind of like, they're the ones who we begin working with, who are evangelizing from the inside, who are helping set up all of the, clinical trials, who are helping kind of break down any hurdles or barriers if they may be any. And we see them as kind of the seed, the catalyst within the hospitals, to really allow technology like this to work itself into the organizations, an organization that is otherwise very careful and may be perceived as slow moving, but because in many of these places there are individuals who have a vision and who believe and who really want what's best for everybody, the patients, the hospitals, them, they are in many ways a catalyst to allow this technology to get into the hospitals in a much quicker way than you may otherwise think. And they have to be creative with funding many times. They have to be creative with, how this is positioned. But believe me, I mean, they are, and we see it over and over, they are evangelists and they are, believers, and they are in many cases the ones that to help advance individual hospitals, which goes to the system, which kind of goes to the community in general, as others see what they're doing through social media or through, presentations, through outbound education that a lot of these hospitals do, through outbound marketing. And so we've seen cases where we thought this technology would never be embraced, and it gets embraced quickly, and other people see it, and then they embrace it quickly. So it's very interesting, the dynamic that has been, evolving around technology in general, but specifically technology like this.
So,
and especially,
I know that you've been doing the models.
Mike, I was going to say.
Go ahead.
Oh, sorry. I was going to say one more thing that we've seen for sure is that, having worked in a variety of verticals, in our past, I think a lot of the excitement and enthusiasm that stems from the medical side and is providing some of the inertia to push some of these technologies forward is almost the fact that there's so many instances where we hear anecdotes from doctors where it was like essentially before some of these visualization technologies, they were almost flying blind in some of the surgery. So So this has given them, these visualizations have given them a whole new perspective, whether, being able to see a tumor in a new way to make a more efficient surgery and ultimately what results in a better outcome. I think, just one single patient that you help with that, just energizes, some of the leaders that Ed has been talking about, that we're talking to in this space, because they're just so excited because they know what good can come from this. Especially in a medical context, as opposed to when, in previous verticals of sports and stuff, yeah, it's exciting to provide fans a whole new experience, but this type of technology is helping save lives, so that I think is where a lot of the, inertia is coming from in a medical context, as helping propel these technologies forward, at a more rapid pace than you would think.
So I know that you guys have done modeling on specific body parts, such as the lungs. You've now embraced this sort of full body. Where are you going?
Yeah, and it's a great question, Mike. And one of the interesting, a fourth big point that I'll make as far as where we're going, and that kind of dovetails into kind of the broader discussion. We are constantly kind of, coming up with additional functionality. We're constantly coming up with new use cases. One of the most recent kind of variations of the MedMirror product that we just started showing this week is a 3-screen version of the MedMirror. We call it the MedMirror Max, which is absolutely incredible. So instead of one single large screen, we actually have 3 screens aligned, together, that are all oriented vertically, that create one extra wide MedMirror. So it basically expands the universe real estate that you are experiencing, and it's really phenomenal. And it's really stunning when you see it. And so it is for hospital lobbies, for large areas where you want to kind of have maximum exposure, for waiting rooms, for special innovation labs, even for special events. This MedMirror Max, as stunning as the MedMirror is, this is even more stunning, and allows for even greater excitement, greater delight, greater enthusiasm. But that's just kind of a visual thing. The real value is on the things that we're doing underneath the covers. And when we talk about kind of next steps and where we're going with this, there's a ton of exciting activity, and I can kind of touch on a couple of things to give you some examples. Of course, what we talked about is the ability in the mirror to see any type of anatomy or any type of animation that has, shows some type of physiology, how a circulatory system works or how a respiratory system works. And that's all very understandable, and that's all very exciting. What we're coming up with now are specific modules that can work with specific types of cases. And I know we talked about thoracic scoliosis cases before. And so we're coming up with specific modules that allow, in a special way, allow content to be brought in, 3D content to be imported from anything, even from an X-ray, and then have that module show kind of the before, the after. We talked about this a little bit, all in the same experience. So you don't even have to wait for the procedure, the surgery to be done to correct it. You can see it all at one time. And so the idea where the family, the patient, gets this sense of hope, and a hospital can buy this as a turnkey system and install it and have it up and running the next day is incredible. So specific modules for specific types of cases that allow these immediate types of use today. And here again, this is, and we talked about this a little bit last year, part of our vision and part of our real excitement is to bring this technology, make it available for use cases literally today, not virtual surgery or augmented surgery that is 3 or 5 years down the road, and this is all just building towards that. The idea is to do things that have an impact right away, which is super exciting for us. So the first thing is these amazing types of modules that can be applied towards specific areas. And then beyond that, there are exciting versions of the MedMirror, and just to touch on things a little bit, that allow for all different kinds of interactivity and patient experiences. So incorporating, everything from touch screens to hand gestures to remote controls, and allowing kind of any kind of interactivity. And then the other area that I'll just touch on a little bit to give a little bit of a little bit of indicator is the idea of also providing other types of potential biofeedback from the mirror. So the idea that, oh my gosh, it's not just an output device, but it's also an input device where, maybe the mirror can, watch your gait and you're walking and make sure you're walking okay. Or for physical therapy, see how much you can rotate your arm, how many degrees you can raise it. All of those kinds of wonderful things where it all expands the universe of what the mirror can do on the healthcare front, and how it can kind of follow our mission of being able to encourage good health, monitor good health, at the same time as uplifting the spirit and motivating you.
And I guess my last point might be that, this still all falls under the realm of medical data, right?
Yeah.
So how do you protect it, and how do you ensure that, privacy concerns and breaches and stuff like that when you're sending this data out to their iPad or something like that?
Yes, no, so it's a great question. And we may have touched on this a little bit last year. So what we are doing specifically, we actually are working with a big security firm here in the Midwest, and building kind of all of our systems with that in mind, and creating kind of this phased roadmap, and being able to offer various levels of these products to accommodate every hospital system, any HIPAA concerns, security concerns, and creating our platform so that it can be implemented in multiple different ways, meaning it can be implemented potentially on a secure external cloud environment to the hospital, or it could also be implemented with systems that are completely behind the hospital's firewall. So effectively, everything running on their internal systems, including an internal kind of white labeled version of the MedReality database and systems, including all of the MedMirror control systems, so that we can accommodate any type of security environment or infrastructure that is desired by the hospital. And in many cases, we're getting started right away with hospital systems using a version of the MedMirror that maybe only uses generic anatomies to start with, to convey specific experience, specific educational packages, and then a roadmap to kind of transition that into patient-specific anatomies as they implement, all the systems behind their firewall. So we kind of have this way to get going and then transition into the fully loaded patient-specific system over time.
So gentlemen, tell me, if folks want to learn more about what you guys are working on or see some examples, where should they go?
They should definitely check out. We post a ton of stuff on our social media too, so they can follow us. At MedReality app. We post a lot of our kind of latest videos on there. Latest short video demos. Yeah. Sorry, on Twitter. Twitter, LinkedIn. We like to post a lot of kind of insights into the latest that we're doing. Or of course, they can kind of visit our website at MedReality.com, and we have a ton of info there on the MedMirror and all kinds of latest items.
So we'll make it a point to add those links below, so that if you want to check out what's going on and what the latest and greatest, you can check out the website or their social media channels. Again, gentlemen, it's a pleasure to see you again, and Evan, to meet you. We look forward to the next update. You guys sound like you're doing some exciting stuff, so we definitely look forward to great things from MedReality.
Thank you, Mike.
Thanks, guys.
Thanks, Mike. Great seeing you again. Really enjoyed it.
All right. Take care.